Well, good evening and welcome to the 7 o'clock talk. Hopefully, the microphones are doing well because we just added new mics and I don't know how they sound. It's hard to test this. Um, Tonight, we're going to go over some case studies. And as we go over case studies, I want to go over, we're going to go over a thyroid case. We're going to go over I think your thing there is making it think that, there we go. It was giving us the down thumb, and nobody's on the stream yet. But we're going to go over a thyroid case, actually, a Hashimoto's case. We're also going to go over a 77-year-old chronic pain case. We're going to talk about neuropathy. Hello, Zoe. Zoe's on the line. Say hi. And we are also going to talk about neuropathy that we are starting. We have actually put a package together on best practices for neuropathy. And I'll let Jessica start out with covering erectile dysfunction in her case study.
Well, it's not my case study, it's actually my patient. Um, we're having great success with shockwave and erectile dysfunction. So if you, a friend or family member, has issues in that department, then we can help. So week 5 of my patient with erectile dysfunction who had significant, severe, probably erectile dysfunction. And in all honesty, we do questionnaires, but they filled out the front and not the back. But if you take page 1 from each of them, and you look at them after the 5th visit, he is significantly better. 0 being terrible to 5 being the best. He went from 2 to 5. So 2 is severe and 5 is mild to no issues. So we're excited about that.
Well, he's gotten his life back.
Yeah.
He's much happier in that
Yeah,
department.
we've talked in length about nutrition, diet, exercise, and erectile dysfunction in general. We usually say 6 visits is a good number of treatments. You should really have you should see noticeable difference after the first visit, and should get better and better. You should see a significant improvement from weeks 3 and 5. So usually we say 6 treatments, but it can be 6 to 10, especially if you have a lot of issues. But it's wonderful to see people come in and regain their sexual health from the very first visit.
I would add to that, you are screened. So if you're having these problems,
Yeah, so
you have to qualify.
So we do self-reported surveys, and Shockwave is a wonderful tool for chronic issues, which include erectile dysfunction. But even though this person was severe, we look at the scoring. We also look at the person, and if you score above a certain level, you can get a benefit from shockwave, but we are most interested in the mild to moderate because they're going to get the most significant. We're not saying we wouldn't help somebody with a severe, but we have to weigh the circumstances. They can't be a diabetic and be severe. And so there's multiple factors that go into screening somebody for shockwave therapy for erectile dysfunction.
So basically, you have to be qualified to do this. And then once you're qualified to do this, even this patient was actually qualified on the questions that he answered. He qualified as severe, but even he got significant improvements. So he's doing a wonderful job.
But he wasn't a diabetic and he didn't have the other issues. Anyway, if you are having erectile dysfunction and you don't want to take medications or you don't qualify for medications, look up shockwave therapy. These therapies, like I said, 6 treatments is usually the minimum. 10 is usually between 6 and 10 is a full treatment plan. And people that get their diet under control and are young enough and can turn that around may never have any issues. Usually, most people get 18 to 24 months, and then they might need a touch up every 6 months. So I'm really excited about this. We are super excited about that because it doesn't just affect people's relationship. It has a lot to do with how they feel about themselves. They get their confidence back and they get them living their life again. So I am super passionate about everybody living their best life, especially getting their hormones and everything in their life optimized.
So let's go one better. Instead of looking up shockwave, actually just call, email. We can send you the questionnaire, get you qualified. If you are doing 10 shockwave treatments, just the shockwave treatments, how much is that? And you can go look around and do any type of searching. She is the best value for shockwave for erectile dysfunction that you will find.
Yeah, if you are in my area, so for 10 treatments, if you needed 10 treatments, it's $3,000. So it's $300 a session. And to quantify that, if you did not have insurance and you were just buying Viagra, a 30-day supply is $2,700. But most insurance companies limit you to 6 pills a month. So with this, I've had patients that were utilizing an erectile dysfunction medication and they no longer are using
They
that.
got rid of it.
Yeah.
So that is a great value. You're now not injuring kidneys or organs or whatnot. So hit up mrsindianabackdoc@gmail.com. You can call the clinic at 812-346-1757. We can get you the questionnaire and tell you how you can do. The next thing I want to cover is, let's go with our Hashimoto's thyroid patient. So we had a Hashimoto's thyroid patient start with us, and her initial score was a 25, and she was having headaches, brain fog, watery eyes, itchy eyes, all kinds of allergy type symptoms, ringing in the ears. Let's see, skin issues, rashes, itching, heart palpitations. She was also having pain in her joints and muscles. She was worried about her weight. She was starting to gain weight. Her energy was low. Her emotions, she was a basket case in her words. And within, it looks like 1, 2, 3, 4, 5, 6, 7, 8, about 10 months doing just lifestyle and functional medicine, she went from a beginning score of, boy, you can't see that for crap.
Just tell them.
Yeah, it's a 25. She started at a 25, and now she self reports. We use questionnaires, and we are nowhere near them when they are answering this. She now self reports as a 1. She has some dry eyes, and you've already addressed that with her. So this is another person who was looking at medications and they wanted to put her on thyroid medication, and she has taken that and turned that around, and in less than 4 months she was from a 25 to a 9. And then we kept on digging into what the causes were, what the problems were, supporting her body and allowing the body itself to heal. So thyroid, I love thyroid issues because these people can turn around very quickly, have their energy, have everything. And then if they're throwing antibodies, we can start to dig into the antibodies and get the body back to where it feels great. The next thing I want to cover is we had a 77-year-old who comes in reporting 54 individual symptoms, and that was on her initial. And as we look at how she did, she went from a 54, now 77 years old. It did take us 18 months, but she now self reports as having 5 symptoms. And you can't see that, but it's down to 5 symptoms. She's having some bags under the eyes still. She's having some hay fever issues. And this person has had a previous GI surgery. So, one of the things that we can't fix, reverse, is that. And so she still has some GI symptoms, although greatly reduced to the point that she has her life back. And once again, this is the power of the body when supported and given guidance, it heals itself. And so now, last but not least, do you want to talk about you're rolling out neuropathy now, best practices?
Our shockwave, our program is really growing fast. We get such good results from it, and we have so many patients that come in that are interested.
Let me interrupt. If you're even remotely interested in the shockwave, you have to get on her schedule soon because it is filling up quickly. Go ahead. Sorry.
Yeah, so I'm super excited about it. I just love this machine, and I love the ability to help people that with chronic issues that are looking or needing surgeries and that have had pain for 20 plus years, and they come in and by the second visit, actually the first visit, they get off my table and it's the first time they've been pain free in 20 years, and they keep coming back because they continually get better, so they start working on something else. But anyway, we've had a lot of our patients ask about neuropathy, and shockwave is a wonderful tool to help with neuropathy. So
neuropathy is a complex and complicated dysfunction.
Yeah, and I'm specifically talking about feet. Everybody is always complaining about the neuropathy in their feet. And so I do lots of research, watch lots of videos, and run down all the rabbit holes. So neuropathy, peripheral neuropathy of the feet can absolutely be helped with shockwave. That takes a little longer, about 10 sessions. If you're going to get results, or if it's going to help you, you should see it by the third visit. But then we have talked about a program that's going to utilize nutrition and all kinds of things to help people get their life back.
So we have packaged the best practices for neuropathy. What we have seen in functional medicine, what we have seen in shockwave, the research. And so the program starts with, we're doing 10 shockwave sessions. We are doing 10 of the foot baths, the ionic foot baths with the magnesium salts to help the feet absorb the magnesium that helps with the nerves. And then we're doing 10 acupunctures with stimulation. And I realize you are probably starting to rack up some big numbers in your head when we start to talk about 3 powerhouse therapies like that. On top of that,
Don't tell them what. We're gonna use.
on top of that, we are doing supplements, and there are one, two, three, four. There are four supplements, but one of those supplements is a multi-pack. So there are five supplements in that. And this is to, you get a 3 month supply, because that's what the studies show the most bang for your buck is this 3 month supply. You get the entire package all wrapped up, along with the ability to ask questions. We give you our email and we get back to you within, generally within a couple of hours. Um, and then if you're talking to Jessica and you need more support, she will talk to you about other things. So all the nutrition for 3 months that you need, the shockwave, the foot bath, and the acupuncture with stem comes out to be $2,733. Go shop that all you want. That is one of the best bangs for your buck on getting rid of the neuropathy. You're going to talk about.
Well, and those visits are not in and out visits, so that's about an hour and a half of your time every week.
Yeah, you have a component of time. Your components are time and money. Our components are time, and then all of the supplies that you need for this. And basically, if you qualify for that, because we will ask questions and we'll have some questionnaires, but if you qualify for that, then what happens is you get this all, and then you get to work through it. The research and what our experience shows is you should see changes and significant changes within 3 to 4 visits. If you're not seeing those changes within those 4 visits,
It's 3.
within those 3 visits, then what we will do is we stop right there, and whatever the balance is, you get the balance back. That's our guarantee to you. But if you go past that 3rd visit into the 4th visit for more and more and more, we know it's working. We know you're happy with it. And so we're going to ride that until the end, until that 10th one. So that is, if you're worried, you can try it for 3. And then at the end of that 3rd, if you're seeing progress, whatnot, you'll be filling out a questionnaire. If you're not seeing anything, we don't want to waste your time and we don't want to waste your money. And we'll help point you into a direction that you should probably go at that point in time. But it's quite a deal at $2,700 to get neuropathy taken care of, when we are looking at people who spend. We looked at similar programs and they're $10,000 and $20,000, and we're not cheap, but we also don't want to put somebody into stress and have them worried about making payments on $10,000. I mean, we still can't wrap our heads around that. I mean, maybe it's just because we're small town doctors and we care about you and we want to take care of you, but that's what we came up with. So there are the results. Great on thyroid. We help reverse father time for a 77-year-old who is now out living her best life. She's back on the lecture circuit. She's doing a great job. Our our most recent, I should say, most recent erectile dysfunction case, who was the most severe, is getting fabulous results, not to mention the others who just are doing great. And you got to remember, when you are looking at, let's talk price for a second. When you are thinking about the price of things, you have to realize that most of the times you're getting rid of medications. You're doing this in a more natural way, so you're not straining the liver, you're not causing stress on the kidneys, and you're not causing problems. So you are not only saving money because of the medications, but you're also saving health and health span, and you can't put a price on that. the stuff that we do does not cause compromise in the body. And you cannot put a price on that. Anything else you want to say in closing?
Come see me.
We would love to help you once again, Integrated Health of Indiana. This is Nurse Jessica. I'm Dr. Trevor Miller. You can reach us at 812-346-1757, or you can email us at drmiller at Integrated Health of Indiana or Mrs. Indiana Backdoc at gmail.com. Thank you and have a great evening.